Saudi women. Actually, the first Saudi dentist certified trainer in emotional intelligence skills, and has trained more than 3,500 people already, is a Saudi doctor, Dr. Hebah Faden, who is with us on the telephone. If we would take the call. Dr. Hebah, do you hear me? Dr. Hebah, is she with us?
I mean, emotional intelligence is just interesting.
Hi, Dr. Hebah. Good evening. How are you?
Good evening. I'm fine. Thank you.
How are you feeling?
I'm fine. I'm a lot better. Thank you.
Excellent. Dr. Hebah, thank you very much for joining Bridges' show tonight. And let me start by saying that an impressive short bio that I've read out loud. Before I present you to the viewers, I'd like you to be the one to tell us who is Dr. Hebah as a person, and we'll continue asking you why we're so proud to have you on the show.
Thank you very much, first of all, Monica, and I'm really honored to be on this show, especially that I saw the previous talk that you had about Saudi women. I hope that I represent my country in the brightest view. Actually, I'm studying dentistry now. I finished, first of all, dentistry in King Abdulaziz University in Jeddah, and now I'm doing my MSc in a new specialty in dentistry called sedation and special care at King's College. This is a new specialty. It's newly introduced here in UK. This is the first year, and it's not yet introduced in Saudi Arabia. I hope I'll be a pioneer in that area when I come back. It's more about the holistic approach of treating patients, mind, body, and soul, where we consider all different aspects of physical, medical, other psychological restraints that can sometimes prevent them from seeking care. And I hope that's care and that type of issues. At the same time, training, as you previously mentioned, I tackled some issues in the intelligence, emotional area. We started here a series or self-development program with coordination with the cultural attachment. First, for the Saudi student, graduated and post-graduated students on scholarships here. We conducted more than 9 different programs, so we can balance between the achievements they're progressing in the scientific and academic life and in the lifestyle on the other hand, and the cultural differences we're all facing by going to another community and facing all sorts of different kind of stuff here. So alhamdulillah, we have achieved a lot of good kind of results in progressing in the personality things and charisma. How to achieve kind of preventive skills, how to prevent stress and kind of negative emotions, especially that we're all away from our family and
absolutely. And this brings me to a question, Dr. Hebah. What deviated you to actually undergo this type of study? Because it's not pretty common. I know that that this actually has not yet been introduced to the Kingdom of Saudi Arabia, so you're going to bring a lot of new knowledge to the kingdom. What was it that pushed you into specifically specializing in this type of study?
Well, during my studies and training, even when I was undergraduate in Saudi Arabia, I realized that a lot of people are really not coming to the dentist just because of the psychological restraint. They always are phobic, have kind of childhood traumas and things like that that are not yet bringing them to the level that they have to be in the awareness of oral health care. So that made me think a lot. Are we really treating the person, or are we treating the tooth? Are we looking to him as a patient, as a toothache, or is it a person that needs care?
Right.
And once I started to read more and more, I found that our old scientists, Muslim scientists, had that concept of holistic approach. You're looking to the human being as a soul and mind and body. So the effects that having different negative thoughts about their health and their self-esteem can affect the way they are treating themselves, the way they're seeking help for their health and other issues. So starting from that, I started really to look, where can I study something that's really new and can break that barrier so people can really cross that area and proceed in the type of care that they need.
Trespass that barrier they probably create. Well, it is again impressive. But I had another question. You're going to bring this new science into Saudi Arabia, and you're going to be establishing. You actually are training people. As far as I'm concerned, you've trained probably more than 3,500 people. So you intend to come back to Saudi Arabia at some point, and you're going to bring this knowledge with you. How do you think you are helping Saudi Arabia now from abroad, your country? How do you think you are helping Saudi Arabia when you're studying and you're preparing yourself?
Well, by studying, gaining the knowledge, seriously going into depth with scientific and updated knowledge, and conducting several types of